Hello and welcome to this 4-part mini-series on coronary artery disease, where we focus on risk factors and preventative strategies you can incorporate into your daily lives. In this series, we'll discuss what is coronary artery disease and why does it happen, modifiable risk factors, non-modifiable risk factors, and lastly, what preventative strategies can you take to prevent coronary artery disease. So, what is coronary artery disease, otherwise shortened as CAD? This condition refers to the state of the blood vessel supplying blood flow to the heart itself. When these arteries become diseased with fatty plaque buildup, known as atheroma, they are narrowed, leading to reduced and turbulent blood flow. The plaque itself may also grow big enough to entirely cut off blood flow in the artery, or it can burst and result in a blood clot. This can then travel to the heart, brain, lungs, or other organs, causing serious complications such as heart attacks and strokes. Symptoms of coronary artery disease may present as chest pain, shortness of breath, heart palpitations, swelling in hands or feet, or nausea or sudden dizziness. It's important to note that this list is not extensive and other symptoms may also be present. Now, let's finish off this intro to CAD with some important numbers. As of September 2024, it is estimated that over 250 million people are living with CAD. 2.3 million of these are in the UK. In 2021, an estimated 9 million global deaths were responsible to CAD. In 2022, CAD was responsible for 68,078 deaths in the UK. Every 8 minutes, someone in the UK dies from CAD. And lastly, CAD is the number one cause of death globally, so it's important that we understand this disease. Hello and welcome to the second video in this 4-part mini-series on coronary artery disease. Today we'll be focusing on the modifiable risk factors of CAD. Whether a factor is modifiable or not is reliant on the ability to change this factor. For example, a lifestyle change such as smoking would be modifiable, while a factor such as age would be non-modifiable, as we have no influence over this. So, let's take a look at some modifiable risk factors. It is important to note that this list is not comprehensive, but will mention factors that are considered to be among the major modifiable risk factors for CAD. This includes high blood pressure, otherwise known as hypertension, high cholesterol, diabetes, and smoking. Other risk factors worth mentioning that we will not be discussing in further depth is obesity, poor diet, high levels of stress, low exercise levels, and poor sleep quality. Starting with hypertension, the American Heart Association labels this as a blood pressure measurement greater than 120/80. While a review of different studies found that hypertension increases the risk of CAD across the board, the impact of hypertension was even more evident in younger patients. One study found the risk of CAD to increase by double for every 20/10 increase in blood pressure. Similar data was observed in cases of high cholesterol. One study reports that every 10 years of having elevated cholesterol levels can result in a doubled risk of developing CAD. Moving on to diabetes, CAD actually serves as the main cause of death in both type 1 and type 2 diabetes. Patients with diabetes are generally reported to be 2 to 4 times more likely to develop CAD than non-diabetics. While the diagnosis of type 1 diabetes itself is considered a genetic factor and cannot be managed, treatment of both type 1 and type 2 diabetes is considered manageable. Proper glycemic control in diabetes has been linked to lower incidences of CAD by around 15%. Shifting over to smoking, studies claim that a majority of CAD cases can be attributed to this habit regardless of age. This occurs more often in current smokers, as well as both males and females in their 40s. Smokers in this category were also reported to be more than 4 times as likely as non-smokers to develop CAD. Furthermore, exposure to secondhand smoke is also thought to increase risk of developing CAD. This wraps up part 2 of this coronary artery disease mini-series where we discussed modifiable risk factors of the disease. In the next video, we'll be briefly discussing non-modifiable risk factors. Welcome back to this 4-part mini-series on coronary artery disease. This is the third video in the series discussing non-modifiable risk factors. In parts 1 and 2, we discussed what is coronary artery disease and some modifiable risk factors. I recommend taking a look at those videos before continuing on with this one if you haven't already. In part 2, we discussed the difference between modifiable and non-modifiable risk factors. As a refresher, non-modifiable risk factors are aspects that we have no control over. Today we will be discussing how gender, age, ethnicity, and family history can impact your risk of developing CAD. In general, it is thought that men are more likely to develop CAD than women. At 40 years old, it was estimated that the risk of developing CAD for men was 49%, while for women it was only 32%. Women seem to be affected greater by modifiable risk factors such as smoking and diabetes. and often develop CAD around 7 to 10 years after men. In fact, the NIH estimates that risk of CAD increases greatly after the age of 45 in men and 55 in women, likely tied to hormonal changes in menopause. As you can see here, the risk of CAD greatly increases in both genders between the ages of 40 to 59. Furthermore, in men, this risk quadruples in the 60 to 79 age group, while it more than doubles in the women's group. Ethnicity was also found to play a role in CAD risk. Hispanics, Latinos, Southeast Asians, and Blacks were seen to have increased risk of CAD morbidity. For example, here we see that while there is no significant difference in total CAD incidence between Black and Caucasian men, there's a significant difference in the rates of fatal CAD. Lastly, one of the greatest risk factors for CAD is family history. Having a brother or father diagnosed with CAD before being 55 years old is linked to higher risks of CAD. A similar observation was found with having a sister or a mother diagnosed with CAD before 65 years of age. One study even found that a family history of premature coronary artery disease can result in as much of an almost 5% increase in CAD mortality. This completes the risk factors portion of this mini-series. Our last video discusses preventative strategies and steps you can take to decrease your risk of coronary artery disease. Hello and welcome to the fourth and final video in our 4-part mini-series about coronary artery disease. Today we'll be focusing on preventative strategies for CAD and what steps you can take in your daily lives to reduce your risk of CAD. We will be covering the impact of quitting smoking, eating a healthy diet, exercising regularly, and lastly, adhering to prescribed medication. Again, this is not a comprehensive list, and I strongly recommend speaking to your doctor on what methods may work best for you. While we previously discussed smoking as a risk factor for CAD, smoking cessation can actually prove to have immediate results. According to the American Lung Association, after just 1 year of quitting, the risk of CAD becomes half that of a smoker. This risk continues to decrease until around 15 years of quitting, where the risk becomes the same of a non-smoker. Furthermore, even after CAD diagnosis, those who quit smoking were found to be a third less likely to have a second cardiovascular event. We can conclude that smoking cessation at any stage is greatly beneficial in managing CAD risk. Eating a healthy diet is another strategy to limit CAD risk. A systemic review of different studies found that increasing intake of fruits and vegetables, whole grain, oily fish, and fiber all seem to be useful in the prevention of CAD. A small change in diet, such as a 4-serving per week increase in nut intake, was associated with a 22% decreased risk of developing CAD. Similarly, greater adherence to a Mediterranean diet was found to decrease risk of CAD death by 33%. Exercise was another preventative strategy found to be beneficial in reducing CAD risk. It is recommended to complete at least 150 minutes of moderate intensity activity per week. This includes activities such as biking, active yoga, brisk walking, or hiking. Furthermore, at least 75 minutes of vigorous intensity activity per week is also recommended. Examples of this would be jogging, playing tennis, or swimming. Lastly, adherence to prescribed medication is important in both managing the risk of CAD as well as the risk of adverse outcomes after someone has already been diagnosed with CAD. These can include medications to manage risk factors mentioned in Part 2 of this series, such as statins to manage cholesterol levels, beta blockers to lower blood pressure, or insulin to help manage one's diabetes. Good adherence to medications can both limit risk of developing CAD as well as lower risk of mortality after CAD diagnosis by as much as 46%. Please consult with your doctor before starting or changing any medications for CAD. This concludes our 4-part series on coronary artery disease, where we discussed what CAD is, manageable and non-manageable risk factors for CAD, and what preventative strategies you can take to reduce your risk. Special thanks to Flaticon for some of the images used in these videos, as well as a massive thank you to you, the viewers, for watching and following along.